is my pleasure to introduce Emily Brennan and Amanda Davis.
Thank you, Deborah. Sorry about that. And thank you all so much for attending this webinar today, hosted by NNLM RML Region 2. This is the second webinar in a three-part series on evidence-based practice. And today we will be focusing on literature searching.
Hi, I'm Emily Brennan, a research and education informationist at the Medical University of South Carolina Libraries in Charleston.
And I am Amanda Davis, and I'm the manager of the Value Institute at MUSC Health in Charleston.
As part of the MUSC Libraries, I work in the Research and Education Services Department. I'm the liaison to the College of Medicine, residents and fellows, and hospital nurses, providing educational, research, and clinical support for students, staff, and faculty. I'm also a member of the Value Institute.
Thanks, Emily. We're so lucky to have you on our team. The Value Institute falls under MUSC Health's Population Health Department and lives within quality at the system level for our organization. We provide EVP education to frontline staff and evidence synthesis services, as well as facilitate the development of hospital guidelines and clinical pathways with interprofessional teams across the health system. So after completing this class, participants should be able to locate background and foreground information, develop effective search strategies in order to find relevant evidence, and identify the role of the librarian in searching and article selection. And during the previous webinar, we focused on step 1 of the EVP process, ask the question. We will do a brief recap of that before moving on to step 2. So I'm excited to pass off to Emily to tell us all about it.
So our clinical scenario that we worked on last webinar involved focus groups that were held by Nursing Shared Governance. Nursing administration asked for our help in investigating the effectiveness of mindfulness interventions on preventing and treating burnout in hospital nurses. Based on the clinical scenario, we identified the PICO elements of our question. Our population of interest is hospital nurses. The intervention we are proposing is mindfulness. We don't have a direct comparison, and the outcome we hope to decrease is professional burnout. Knowing the type of question that you have will help you phrase your clinical question in a standardized way. So I'm going to kind of go over these types of questions, and then we can talk about what we ended up for our scenario. A diagnosis question would address how to select and interpret diagnostic tests in order to confirm or exclude a diagnosis, and takes into consideration sensitivity and specificity of diagnostic tests. A therapy question would address how to select a treatment that does more harm than good, and attempts to answer the questions, does the treatment work, and how effective is that intervention? A prognosis question would estimate the patient's likely clinical course over time and anticipate likely complications of disease. An etiology harm question would attempt to identify causes for the disease and may also attempt to answer the question, what is the harmful effect of an intervention or exposure? And a prevention question would address how to reduce the chance of a disease or outcome by identifying and modifying risk factors, and also how to diagnose early by screening. In our clinical scenario, some nurses were already experiencing burnout, therefore this could be a therapy question. However, for the nurses not yet experiencing burnout, the mindfulness intervention could be used to prevent burnout. Therefore, this could also be a prevention question. For the purposes of this presentation, we're going to frame this as a therapy question, which is, in hospital nurses, what is the effect of mindfulness on burnout? And now we're going to move on to step 2 of the evidence-based practice process, which is to acquire evidence. Evidence-based practice is defined as the integration of best research evidence with clinical expertise and patient values. And today, our goal will really be focusing on finding the best available scientific evidence. During the previous webinar, during the previous webinar, we discussed a wide variety of roles that librarians have in supporting and practicing evidence-based practice. But now I want to focus on the role of the librarian specifically related to literature searching. Our expertise in literature searching is one of our most valuable contributions to evidence-based practice. We are experts in identifying appropriate databases and other resources, developing comprehensive search strategies, and managing references. Another role that we often take on is related to article selection. We can provide a set of potentially relevant articles as a starting point for our patrons. And lastly, we can offer an objective viewpoint when searching for and selecting relevant articles, so as to not introduce bias. Sometimes patrons will ask us for evidence to support a specific recommendation, but if we notice through our literature search that the recommendations are leaning in a different direction, it's up to us to provide complete, unfiltered evidence so that they can make an informed decision based on the body of literature, not just a few hand-selected articles. Sometimes it's helpful to gather background information on a topic to help provide context and fill gaps in knowledge. Background information provides general knowledge on a topic, such as definitions, etiology, pathophysiology, diagnosis, management, and prevalence. The more unfamiliar you are with the topic, the more background information you will need. Background information also helps us generate synonyms for our PICO concepts in the event that we need to develop a comprehensive search strategy. You could gather some background information through reference interviews with your patrons or requesters. When I work on hospital guidelines, I'm invited to the meetings with interprofessional teams as they are developing those PICO questions. And they do brainstorming and process mapping exercises that provide valuable context and information for each PICO question that help me as I'm searching the literature. So background questions related to burnout could be, what's the definition of burnout? How does burnout relate to compassion fatigue? And are there certain specialties that are more prone to experiencing burnout than others? Ebooks are a good starting point for background information. And then also UpToDate and Dynamed and other point of care resources bridge the gap between background and foreground information. So we're just going to take a look at a few of the book chapters and kind of see what information that we can glean from those. This book chapter defines burnout and also describes compassion fatigue, which is a related term. Knowing related and broader terms may be useful in case you need to broaden your search strategy because of the lack of evidence. In addition to defining burnout, this book chapter also mentions the Maslach burnout inventory, and this piece of information may be helpful to your patrons. Perhaps they've already identified which tool they will use to measure burnout, but if not, you could suggest this tool. And this could become part of the inclusion criteria that you all will use as you go through and select the most relevant articles. And this Dynamed summary also provides a definition of burnout and mentions the Maslach burnout inventory as well. This book chapter describes mindfulness as an intervention to prevent and treat professional burnout, which perfectly aligns with our PICO question. It also describes a study that found that the positive effects of mindfulness intervention were maintained over the length of the 9-month study, despite there being no booster session or follow-up trainings. This information may be useful for nursing administration as they plan their own mindfulness intervention. It could help them decide the frequency of mindfulness sessions, as well as the frequency of follow-up surveys for nurses receiving the intervention. And this chapter describes mindfulness as a clinician's capacity for reflection, self-monitoring, and self-awareness. These synonyms could serve as additional keywords for your search strategy. They also refer to greater clinician well-being as a sign of lower burnout. And keywords that are antonyms of burnout, such as well-being or resilience, could also be used in our database search strategy. And again, as I mentioned before, UpToDate and Dynamed kind of bridge the gap between background and foreground information. And those summaries can also be used to link to primary research articles. And I'm sorry to pause, but I'm receiving a little feedback. So I just want to make sure that everyone is muted on the Zoom call besides me. Thank you. Okay, so as you can see, gathering background information will help you gain additional knowledge on your topic, provide context, and may contribute to inclusion and exclusion criteria and timelines for follow-up. So now we're going to start to turn our attention a little bit more towards foreground information. The publication types at the top of the evidence pyramid are less prone to bias, and they summarize the primary literature. So for example, one meta-analysis may summarize the findings of 15 randomized controlled trials. Systematic reviews and meta-analyses have rigorous processes in place in an attempt to eliminate bias. Therefore, that meta-analysis has a strong level of evidence and is less time consuming for us to search for and appraise. When we look at the evidence pyramid, we will attempt to find literature at the top of the pyramid and then work our way down. TRIP is a free clinical search engine that categorizes search results based on the type of information. It can be a good place for you to start your research because it provides a quick snapshot of available evidence. TRIP searches over 75 sources to gather evidence from evidence-based synopses, regulatory guidance, clinical guidelines, primary research, and other sources. PubMed references are added every 2 weeks, and other content is added monthly. There is a search feature that is in Pico format. And as you can see, I searched for mindfulness and burnout. I sorted my search results by quality, and you can see that guidelines and systematic reviews are considered the highest level of quality and are highlighted in green. And then there's a little tiny evidence pyramid next to each search result that illustrates where each study falls on that pyramid. And so I think because of the color coding and the inclusion of the evidence pyramid, this is a really useful and intuitive search engine and can be a really good starting point for you as you begin your research. ECRI Guidelines Trust is a guideline repository that attempts to fill the void left by National Guideline Clearinghouse. To be included in ECRI Guidelines Trust, a clinical practice guideline must be produced by a professional medical association, based on a systematic review, include recommendation statements, be published in the last 5 years, and available in English. You do need to create a free account to search this resource. One nice feature is the inclusion of a trust scorecard for each guideline. And that trust scorecard provides a quick visual evaluation of the trustworthiness of the guideline. And it evaluates criteria such as the composition of the guideline development group, the summary of evidence, and the quality of the literature search. So at this point, we've talked about searching ebooks and point of care resources to gather background information, using TRIP to categorize search results by quality, and ECRI Guidelines Trust to find guidelines. So now we can kind of move on to PubMed. And we can use PubMed to find additional guidelines as well as primary research articles. So again, we're just going to attempt to answer our clinical Pico question. So I ran a search for nurses and mindfulness and burnout. And as you can see, the search is very simple. However, I do see relevant systematic reviews and research articles in the search results. And how simple or complex your search strategy needs to be really depends on variables such as the purpose of the search, how much time you have, skill level, research topic, and amount of available evidence. So I kind of just wanted to pause and ask you all to answer a couple of questions. And I want to know from you, and you can put your answers in the chat, how do you determine how comprehensive your search strategy should be? And what factors do you take into consideration? So if everyone just wants to take a moment and answer in the chat, what factors do you take into consideration when deciding how comprehensive your search strategy should be for an EBP search. Okay, so we have amount of relevant results, and it depends where they are in the process, who's asking, what test searches, kind of what results are brought about by those, case by case. Sometimes it's based on an assignment. Okay, so do they need the full text or do they just want abstracts? Yeah, so a lot of you are saying kind of like, it's based on the researcher's needs or what the client needs are. So is it a systematic review? Is it a class assignment? So I think that's a really good point, because I remember like when I was a brand new librarian, I went to my very first EBP workshop taught by Connie Shar, and she did a super simple search. And, I had just started, I just become a librarian, and I was kind of taken aback. I was like, what? She's not using mesh, she's not using this, but here I am many years later, and I realized that it's a lot more complex than that. It depends on the audience and a whole lot of other factors. So I'm just going to kind of pause and kind of reflect on that. So librarians are involved in evidence-based practice in so many different ways, and there are many variables to consider when deciding how comprehensive your search strategy must be. And the first consideration is the purpose of the search. If a student is consulting with you on a class assignment and they just need a couple relevant articles, then a simple search may suffice. If you're teaching an EBM searching session as part of a curricular course, then you should probably spend some time teaching students on how to identify relevant databases and build comprehensive search strategies. On the other hand, if you're on patient rounds with an interprofessional team and they just ask you for like an article just to confirm their treatment plan, then a quick PubMed clinical queries search may be appropriate. Whereas like if you're performing a literature search for the development of an evidence brief or a guideline, then you're going to want to search multiple databases and build reproducible comprehensive search strategies. And related to the purpose of the search is time. So specifically, how much time do you have and how much time would you be reasonably expected to spend on a search? On rounds, you may be expected to retrieve evidence in real time at the bedside, so you may only have a few minutes to do that search. Here at MUSC, we teach a project-based 12-week EBP course for nurses applying for RN3 certification, and we spend weeks teaching literature searching and working with the nurses to identify relevant databases and develop comprehensive search strategies. The next factor to consider is skill level. And this could be your own skill level in literature searching, or it could be another person's skill level. So because I'm I consider myself a somewhat expert searcher, and therefore I can quickly develop a fairly comprehensive search strategy. So I may be more apt to do that than a clinician or a brand new librarian. And I also think it's important that we meet patrons where they are. It is so tempting to attempt to teach every clinician how to develop a complex search strategy, but I think we really need to be cognizant of when that's appropriate and when it's not. And the last factor to consider when deciding how comprehensive your search strategy should be is the amount of available evidence. So I just did a simple PubMed search on nurses and mindfulness and burnout, and I retrieved relevant systematic reviews. Also, I know that there aren't that many synonyms for those search concepts. And I also know that PubMed mapped my keywords to the appropriate mesh terms. So therefore, I don't feel like in this situation, there would be a need to develop a much more complex search strategy. On the other hand, if a simple search does not retrieve relevant articles, then you're going to want to spend time developing a more comprehensive search strategy just to make sure that the lack of evidence is not due to a poor search strategy. So the purpose of the search, time available, skill level, and amount of available evidence should all be taken into consideration when deciding how comprehensive a search strategy should be. This is an example of an evidence brief that we recently completed for our hospital. And at the top, you can see that there's 2 PICO questions And then under the search for evidence section, you will see the search strategies. So I kind of feel like this is kind of like a middle ground. It's an evidence brief, so it was kind of more comprehensive than like for a class assignment, for example. But if this were a guideline, then I would have searched additional databases and developed even more comprehensive search strategies. So back to our clinical question, I could have developed a slightly more complex search strategy, such as this one, using subject headings, synonyms, antonyms, and truncation and field tags. But I'm just going to do a simple search for the reasons I've already mentioned. So we receive 174 results. And the next step in our process is to identify relevant articles. Your role in this process may vary depending on the purpose of the project, your knowledge of the clinical topic, and patron expectations. For the literature reviews, I do evidence briefs. For the literature reviews that I do for evidence briefs and hospital guidelines, I send Amanda the reproducible search strategies in a folder of potentially relevant articles. But she still runs all the searches herself and selects the final articles for inclusion based on her search results and also based on my folder of relevant articles. So again, it really goes back to the expectations of your patrons and requesters. And these are just the factors that we could take into consideration when deciding if an article is relevant or not. So the first is the study appropriate for our PICO question? Like, how similar are the PICO elements in the article compared to the PICO elements in our clinical question? And then next, we want to think about study design. Is the study design high level, and is it appropriate for our question type? Are there any other additional inclusion and exclusion criteria to consider that would be important for the literature search or for article selection? And really all these together will help us determine whether or not an article is relevant. The type of question that we have will help us identify the most appropriate study design. In our scenario, so we had a combination of some nurses were already burnt out and others were not yet. So we could have framed it as a therapy or prevention question, but either way, we really hope to find randomized control trials as our primary research articles. If we can't find RCTs, so sometimes you can't find RCTs either because they're not available, maybe they couldn't have ethically been performed, then you kind of just move on and look for cohort studies or, case control if you have to. So now we know that our goal is to find guidelines, meta-analyses, systematic reviews, and RCTs. So we can use the article type filters in PubMed to limit our search results. So I just applied guidelines, practice guidelines, systematic reviews, meta-analyses, and RCTs. And PubMed differentiates between a guideline and a practice guideline. They define a guideline as work consisting of a set of statements, directions, or principles presenting current or future rules or policy. And the guideline really relates to general conduct and administration of healthcare activities, whereas a practice guideline relates to practice recommendations for a particular clinical condition. So after applying those article type filters, we now have 26 results. So generally, I will just kind of go through these to determine if they're relevant or not. And I'll just kind of show 2 examples right now. So this first article, the PICO elements in this study perfectly match the PICO elements in our research question. It's a systematic review and meta-analysis, which is a high quality study design. It's published in 2020, so fairly recent. So based just on these really simple criteria, I'm going to say that yes, this is relevant. And I typically use the clipboard in PubMed to set aside potentially relevant articles. And then after a second review of those, then I'll save the relevant articles to a collection that I'll share through a public URL. So this second article, the population of interest for this study does match the population of interest for our PICO question, which is hospital nurses. And this study does have a mindfulness intervention, but it also includes a comparison group that received psychoeducation. And burnout here in this study is a secondary outcome, and we'd have to read the full text to see what instrument they use to measure that outcome. It's a randomized control trial, which is appropriate for prevention and therapy questions. So I would consider this as potentially relevant. Whether or not it makes the final cut for inclusion really depends on how many other relevant results we have. So that's why I kind of do like a initial review, see how many I end up with, and then I can be a little more strict in what I want to include and determine as relevant. Clinical queries is another way to search PubMed. And clinical queries uses predefined filters to limit search results to specific publication types based on your question type. This is a really valuable tool for bedside searching, and I think it's underutilized by clinicians, so I promote it every chance I get. So you would enter your search terms and then filter by question type. And we had a therapy question, so I'm going to select that filter. There are also filters for clinical prediction guides, diagnoses, etiology, and prognosis. And the filter details are linked so that you can see the search edge and the sensitivity and specificity. And then you would select the scope, which is either narrow or broad. And the narrow filter will retrieve fewer results, and the broad filter will retrieve more results. So in this case, the narrow therapy filter will retrieve randomized control trials, and then the broad therapy filter will retrieve all clinical trials. And then basically, if you can stay on the screen, or if you click on see all results in PubMed, then you can be brought back to the normal PubMed search result page. And if you look up at the search box, you'll see that the clinical queries hedge was applied to my search strategy. And we now have 32 clinical trials. And the hedge, that the filter that they use for clinical queries is slightly different than the checkbox for the clinical trial article type filter. Okay, so we have 32 clinical trials, but also included in that 32, we also see like a systematic review and meta-analysis that we were looking at before. And it's really just because it contains the keywords clinical and random, which were in the therapy search hedge. And there's a variety of other resources to consider searching as well. And again, what resources you search really depends on, again, like the purpose, the time, skill level, and amount of available evidence. Today, I just focused mostly on TRIP and ECRI and PubMed because those are freely available or they have free components to them. And so that's where I really want to focus. But I really encourage everyone, even if it's just like a simple search strategy for a class assignment, search other resources, because there's unique resources that are not found in PubMed. And especially, obviously, if you're doing a more comprehensive project or a guideline or something like that, you really do want to be comprehensive to make sure that you're gathering all possible evidence on your topic. And then, I also included some gray literature resources as well. And you might want to focus on like international literature like NBASE and Scopus has a little bit more of that as well. And then basically, like I just showed this because there's such an emphasis on peer-reviewed journal articles to support evidence-based decision-making. But I think it's important also to include other article types and resource types as well. I think it's important just to consider including these non-traditional information when you respond to your patrons. And this is an example of a well-being toolkit that was developed by the American Nurses Association. And something like this could be a really welcome addition to include along with journal articles that you would traditionally include as well. And then likewise, something like a discussion paper that could provide really valuable context and background information that would be a valuable supplement to peer-reviewed journal articles. And so I always, like people, when they come to us for evidence-based practice, they have something in mind, but I think it's important to kind of like look at other types of resources, kind of provide that context, provide other tools. And Amanda will talk a little bit more about that when she's talking about the application in the next webinars, and really kind of focusing on like what would be something that's useful for your patrons that they could actually apply in a clinical setting right away. And so really, just to recap, like we discussed the value of background information, factors to consider when deciding how comprehensive a literature search should be, and the role of the librarian in literature searching and article selection. And again, how big of a role librarians take in literature searching and article selection really depends on all of those factors: the purpose, the time, the skill, and the amount of evidence available. And also patron expectations. So you all mentioned that in the chat, but I think that's also a really important thing, is like, what are the expectations, and do you have that agreement before you start that search?
And before we kind of close out and start talking about the next steps in the EBP process, Emily, there are some great questions in the chat that I think might be more appropriate to discuss at this point instead of after we've kind of introduced the last step. I'm not sure your thoughts.
Okay, yeah, let's go. Let me jump into the text and just see where we kind of left off.
So would you like me to feed you some of the questions that have come up from a chat perspective?
I'll kind of address them. I got a private chat.
Okay.
I probably can't see that, but someone asked about the plugin that I have that shows the journals and gives available downloads. And so I'm just going to go back to my screen to address that. So I think this person's talking about this download PDF icon that's showing up below the citation. And that is something that MUSC subscribes to called LibKey Nomad. It's by the same people that put out Browsing. And basically it's just a plugin on a widget. And so you don't have to go through like the find it button, and it just saves you a couple clicks. So that's what that is, LibKey Nomad. So where does PubMed note the difference between a guideline and a practice guideline? Oh God, I found it somewhere in the help section because I copied and pasted the definition. So it's somewhere in there. But again, yeah, like the practice guideline is more clinically focused. It's like clinical recommendations for a clinical topic, whereas a guideline could be a little bit more like process related. Okay, so do you use a tool for article screening? For my role in article selection and screening, I do not. And Amanda will talk a little bit more about article selection because we kind of blur or share that task. I do the initial article selection and then she does the final article selection. But for me, I just really focus on, does it match the PICO? What's the study design? How recent is that, if that's an important factor or not? And then any inclusion, exclusion. So we were talking about the burnout inventory. So if that's something that I can see in the abstract, then, I'll take that into consideration, or any other inclusion, exclusion related to setting and things like that.
Absolutely. Oh, and Emily, I don't know if you want me to kind of speak from my end about that kind of tool perspective. What I have noticed in my collaboration with Emily is that a lot of times her tools are more the what's available in the actual database, so applying filters and things like that. And then what happens on my end is when I apply those same filters that she already has, and sometimes the bucket of literature is still really large. And so then I start applying additional criteria inclusion and exclusion criteria on top of that. And as Emily mentioned, you'll see kind of more that process in action during webinar number 3, and kind of how we applied it to our clinical question about nursing and burnout.
Yes. Okay, so another question, why use plain terms and not mesh terms? So really that goes back to how complex do I want the search to be? So in my case, I saw that it was the keywords were mapping to appropriate mesh terms, and I was also getting high-level study designs, and I wasn't working on a guideline. So that's why I opted to do a more simple keyword search. Whereas there certainly would be cases where I would use a combination of mesh, many different synonyms, field tags, you know, all of those fun things. And I do co-author systematic reviews, and there's nothing I love more than creating a very detailed, reproducible systematic review search. So sometimes I have to rein myself in, depending on the purpose of a search, so that I don't get, you know, caught in the weeds when I don't have to. Yeah, and someone mentioned like Cochrane and clinical trials. Absolutely. So there's so many resources depending on your topic that you could include, and really the inclusion of those more great literature resources would reduce publication bias and be a good idea depending on the purpose of your search. Okay. And then someone was talking about, like, I was touching on the scope of the librarian's role in the systematic review team, and that's important to establish and define at the onset. And I think that is a really good point. So kind of having that initial discussion, the reference interview, setting roles and expectations at the onset is obviously a very good idea for everyone involved. And I would definitely recommend that. And so that's, you know, I think we all kind of do that intuitively just as part of our reference interview, but I think it's something that needs to be maybe formalized more depending on your role and the purpose of the project. If it's just a class assignment versus a guideline, something like that, I think is really important. And we could get into like all sorts of other things like authorship and things like that, which I'm not going to. But yeah, I think just setting expectations and kind of having all of those agreed upon with your team is definitely a good idea for everyone involved.
And Emily, just wanted to kind of piggyback off that. One of the things that was also asked in the chat was related to the language for why, including, you know, toolboxes and things like that in relation to the ANA Wellbeing Initiative. A lot of times it really depends, kind of getting back to the purpose of the request. So in this particular request, it was pertinent to look for non-traditional toolboxes and information, especially because the ANA, the American Nurses Association, is a well-respected association within the nursing community. Most nurses at our institution are members or have been members in the past. And so it was important for us not just to provide the evidence specifically from peer-reviewed journals, but also from some of these non-traditional sources, so that they could use all the different tools at their disposal to make decisions about how they were going to pursue addressing the issue directly at our organization.
Yeah, so that was the mindfulness and burnout in nurses was a real request that we received. And so, yeah, like Amanda mentioned, including some of those like non-traditional, non-really evidence-based resources in this instance was helpful because they did want to have some sort of like a variety of mindfulness initiatives, but one of which was in our systems, our university's learning management system. And so some of those like already developed apps and stuff could be pulled out and applied right away as they develop their own initiatives. But we have time for more Q&A. So I really just want to, I think like oftentimes the Q&A is the most valuable for everyone involved. So definitely put your questions in the chat and then we can continue this discussion. Okay, so we have a question about librarian roles. So she said, I'm new to working with grad nursing students. How much teaching should school nursing faculty expect from me as a liaison research support librarian? In-depth searching, yes, but creating protocols, using Prisma. And again, it just depends on how embedded you can be. So like at our institution, we have the librarians that have dual appointments in different programs such as nursing, and they really co-teach an entire course. And also repetition is always good. So just because you teach something in year one doesn't mean that you can't teach on it and build on it again in year two and year three or year four. So I think it depends on your comfort level. So, if you are new to this, you may not feel comfortable yet, talking about like Prisma or systematic reviews or levels of evidence. So maybe you just start with what you know and your expertise, which would be searching databases, and then you can expand that role and work with the faculty and really kind of becoming a co-lead and a co-faculty on a course. But here at MUSD, we run the gamut. We're involved in curricular instruction. We do standalone sessions. We might do just like a 15-minute, hey, remember me? Here's, just a reminder about clinical queries or, something like that. So I think take what you can get, but know what don't over promise. Like if you are not an expert yet, become an expert and then keep teaching. So what's the difference between exclusion terms and filters? So, okay, so basically when I think about search terms versus inclusion, exclusion criteria, a lot of times that inclusion and exclusion criteria is clinically focused and it's not something that really can be captured in a search. So it could be something like inclusion might be you have to be at a certain stage of a disease. And sometimes that is you're not able to conduct a search all the time that can really get to the nuances of what they want to include. And then also like when we were talking about like the time to follow up or, certain inventories or things like that. So you might have their inclusion criteria might be, well, the studies have to have at least 30 days of follow-up or 60 days of follow-up. That's not something you can always capture through a search, but as you're reviewing abstracts in full text, you can get that information and then decide if an article should be included or excluded. Okay.
Absolutely. That was great. The only thing I would add, Emily, is that from an exclusion criteria, a lot of it is stuff that would, if you could put a not this and make the search run well, it's things that you might want that you might have included there. So for example, in relation to our example, nursing also pulls nursing students. Well, we're interested in frontline nurses. So it's really kind of teasing those things out where if you were to embed it into your search strategy, it may completely make you lose things that are applicable. So we end up applying them on the back end instead.
Exactly. And we had a question about hedges versus filters. So if we talk about the clinical queries, they had a hedge that for therapy articles, right? So they had a broad hedge that included all clinical trials, and then a narrow hedge that included randomized control trials. But they built that hedge based on search terms. So it's just, it's another search concept that they're tacking on to the end of your search. So that would be a hedge. If you go into PubMed and you select the clinical trial that limit, that checkbox, basically that is based on indexing of the articles. So you will get slightly different results using the clinical queries hedge versus the regular PubMed article type filter. Okay, so I had a question about, what about using major topics versus mesh terms? Which ones are better, or using an advanced search? Also, does NIH provide a certificate of attendance of webinars? Deborah can take this certificate of attendance question. Okay, so basically, I mean, okay, so mesh terms and major topics. And again, this all depends on your search, how comprehensive you want to be. If I want to do a comprehensive search, I'm not going to use major topic in the mesh. You know, I'm not going to restrict to major topic in mesh because indexing is not a perfect system. So if I wanted to be more comprehensive, I wouldn't do that. However, if you are okay doing, you know, a more simple search, you're getting more relevant articles, but you don't mind that it's not totally comprehensive, then you could apply that restrict to major heading in mesh. So again, it really depends on the purpose of your search and how comprehensive you're going to be. In this session is really related to like searching, just related to EBP. And so, you know, it was not intended to be like how to search PubMed. There are so many, or how to search anything really. There's so many webinars on that. And, you know, even though I've been searching and doing systematic reviews for years, I still go to all of those webinars and always learn something new. So it is a process that takes a lot of practice and commitment and just trial and error. You know, like when I develop searches, I test them and test them and test them and nod out things to see what I've missed, you know, and all that good stuff. So it's fun, but there's not always just like an easy answer of what to do in every situation. Okay, so there was a question about, oh, I think I addressed this one, guideline versus practice guideline. So I always just select both, because even though PubMed has a definition of when to use each one, I just feel like it's safer to select both of them and it'll order them together. So, you know, according to PubMed, if it's like a practice recommendation for a clinical topic with clinical recommendations, it would be a practice guideline, whereas a just regular guideline could be more focused on like processes and administration. But I don't know, you know, the sensitivity or specificity or how accurate that is. I think just like with indexing mesh terms, you know, we just have to make sure that we're taking that with a grain of salt and we're not depending 100% on the indexing being correct.
Okay. Requester perspective, what I also have noticed is that the distinction between a guideline and a practice guideline a lot of times will relate to whether it's a single institution or a like organizational, national, international guideline, just kind of from the requester end. So I'm not sure how much that plays into the actual filtering on the NNLM side by the librarians, but it's just something I've noticed.
Yeah. And there's just a comment about like systematic reviews. And I will say that, you know, I've worked on national guidelines and the processes really differ. And it really depends on the institution, the team, if they have, you know, a good oversight person from the association, but sometimes they do use a systematic review process to develop a guideline, and other times they take shortcuts. So that's why we do, Amanda, next time we'll talk about evaluating the trustworthiness of guidelines. but also as we saw in the TRIP database, they have that trust scorecard. So if you trust their opinion and want to look up a guideline, you could look at the trust scorecard and see kind of how trustworthy it is. And it does evaluate the search strategy in the systematic review. So that's something to keep in mind as well. Okay, are there any final questions? I know Deborah just needs a couple minutes at the end, but we can take maybe like 1 or 2 questions right now if there are any. Okay, so seeing none, we will look forward. Hopefully we will see you all next Thursday, same time, for the final webinar on appraisal and application. And here's our contact information. So if you do have questions in the meantime, feel free to shoot us an email. And Deborah, if you have any final words, you can go ahead.
I wanted to say thank you again to Emily and Amanda for being here today. We hope that you guys had a good experience. We will be sending out before the end of the day the slides and video from session 1, and the slides and video from session 2 should be much quicker. So in the next few days, we'll be able to get that to you. We do hope that you guys stay in touch with us. If there's anything that Region 2 can do to help, that will be great. I'm about to drop our social media links in the chat. If you guys will follow us, you can find out all the other things that are happening in our region. We really appreciate you taking time to be here, and we hope you have a great rest of your day. Thanks again, guys, for being here. That was awesome.
Thank you so much, everybody.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.